I am delighted this morning to be joined by Fergus Cooper. I've had to write Fergus's title down, who is an ST5 in ENT Surgery and is a specialty trainee. Good morning, Fergus. How are you?
Morning, Caroline. I'm very well, apart from the fact I'm a bit choked up, so apologies in advance if I sound a bit husky. Tested positive for COVID over the weekend when I was meant to be on call.
Oh, so I hope you're feeling okay, but a really timely reminder that COVID remains with us and continues to have a huge impact on lots of colleagues and people across health and care. So thank you for still doing this when you are suffering from COVID. So Fergus, really pleased to have this conversation with you. It feels as if it's been a long time. You're a busy man to get in the diary, and it's been so important to me to be able to speak to our trainees because of the critical role that you and your colleagues have played always, but in particular over the past couple of years. And so just so that I don't forget, I'm going to start off by saying a massive thank you. I know that all trainees have really flexed what they've done to accommodate the changes that we've had to make in NHS Grampian over the past couple of years. And that's really difficult. It's really difficult for everyone, but actually when you're trying to train and ensure that you get the right skills and qualifications to progress in your career, I can only imagine how challenging that has been for you and your colleagues. So massive thank you from me.
Thank you very much. Yeah, it's nice to hear that, and thanks for the opportunity to have this conversation as well.
No problem. I'm sure you're not nervous because I've witnessed you on the television trauma show. So you've done much more bold things than this. So I'm hoping we can just have that as an informal chat for folks to understand what it's been like for you, and hopefully some of your trainee colleagues will hear you reflecting some things that they recognise. So Fergus, a bit about you first. An ST5 ENT in surgery specialty trainee. To people who won't have a clue what that means, tell us a bit about what a day in your life is like at work.
Yeah, so I guess I'm on a path ultimately to be a consultant in ENT surgery, of which there's 8 years of training, and the 5 just means I'm on year 5 of 8, really. So, you know, through over these 8 years, you're meant to get various competencies signed off, and as well as just doing the job of the ENT surgeon day to day, but you're ultimately looking to gain competencies and skills required to be a consultant. And your day-to-day work consists of anything from doing the ward work with the junior doctors, the acute take of patients that are unwell with an ENT illness, looking after them, doing procedural work on the ward for them, or even operations for them, or elective clinics, either at ARI or with END, for things that GPs would refer, or operating, which usually would have been about twice a week for an ENT trainee pre-COVID. However, we're still struggling to get a bit more back to that level since COVID, really. So that's generally what the week involves, and I'm on a rota of 6 other middle grades, I'll say. There's 3 specialty trainees in ENT in Aberdeen, and we all, as a specialty trainee in ENT, you've got to do 3 different centres in Scotland. And being from Aberdeen myself, I'm happiest being here. I know the team well, I get treated well, and I ideally like to do as many years here as possible, but I will have to move away, hopefully to come back at a later date. So that, yeah, there's 6 other people on that middle grade rota, and which means it's a 1 in 6 for being on call. And when you're on call for ENT, you're on call that 24-hour period. So it does mean you can get called in, in the evenings or overnight. Hence why you saw me in my jeans and t-shirt in the trauma program. Sorry about that. Didn't have time to get changed.
No problem at all. So you've said quite a lot in there, Fergus, that I just want to follow up on because I think it's really important. But just so that I don't forget, I always think it's really nice to get to know the person. I think we come to work as people. And for me, building relationships is about knowing what's going on and what motivates Fergus beyond that professional role that you've just described. So just tell us a little bit about something in your life that is out with medicine to allow us to understand either what energizes you or what you do to relax, or just what you do at home.
Yeah, a few things, thankfully, to distract me from the world of medicine. I guess the first thing is that I've managed and played in a five-a-side football team on Wednesdays for at least 5 years. I think I inherited it when I was a junior doctor from another junior doctor that moved away, and
Okay.
it's been a relentless struggle since then to try and find players that can play for us every Wednesday, because rotas, junior doctors' rotas are never consistent, and no one can commit to playing every week. So we've diverged a bit and have some non-medical players, but we like to try and keep it a hospital thing to get
Mm-hmm.
people involved. So I'll plug an advert here. If anyone's, we're losing a few players in August with the rotation, so please approach me if you're keen to play. It is a league, so you do play against other teams, and it can get a bit feisty, but it's good fun. So
Brilliant. We'll
that's
put your email
goals.
address to contact you if you want to join the league in
Brilliant.
the
Yeah.
daily brief.
Yeah, we're Unatletico ARI because the standard's not that great.
Brilliant.
So yeah, a bit of football, because I've always been quite keen on football. Never that good, but keen to play. I play badminton with friends and my wife on one of the days of the week as well. And apart from that, interested in eating at nice restaurants and going on nice holidays, really.
Brilliant, brilliant. And in and amongst your training, your exams, and all the demands that we place on you, that's admirable that you managed to keep that going. So you said, I think in there, that you're from Aberdeen. Was it Aberdeen University that you went to?
Yeah, it was school and university in Aberdeen, and most of my junior doctor years in Aberdeen too.
Ah, the reason I asked, so clearly Aberdeen University attracts undergraduates from internationally, but one of the things that I have noticed in my conversations is around one of the factors of how we recruit and attract people is very much about that training experience and also the undergraduate experience. And one of the biggest determinants of where people choose to work is where life is, where family is, and so it's really nice to have a live example of that in you. So within Aberdeen and choosing, what made you choose ENT? Because you've got a lot of options and choices when you graduate as a medic. You do your FY1, your FY2, and then you have the challenge of what next. So what attracted you to ENT?
Good question. Yeah, and I'm going to put that out there. I didn't choose ENT until right at the end of my core surgical training, which is your first and second years of the 8-year path I'm on just now, because I probably, as a medical student, I always knew I was going to want to do a surgical specialty, just because of the practical side of things. And I don't know why, but surgery always just interested me a bit more than the medical specialties. Um, and I probably wanted to do most surgical specialties at one point, but I knew that I was going to have to experience the actual jobs and see what suited me best. So I did. I finally got to do ENT in my core surgical years, which you do after FY, because I don't think you gain a great insight of the job during foundation years, which is why people want to do tasters. But when I was doing ENT, the thing that appealed to me was the age range of the patients. So you'll see
Okay.
patients, pediatric patients and elderly patients, and mostly a middle-aged population as well. And the anatomy of all the diseases is quite interesting. The areas of anatomy you have to operate on can be quite challenging, but also quite exciting and interesting. There's a lot to learn, and there's a lot you can do in a clinic room that helps as well. Rather than having to operate on everyone, you can help them just by doing a procedure in clinic, such as, showing them back the recording of their laryngoscopy. That's a camera through the nose to see their throat, or, microsuctioning someone's ears, or manipulating a nasal fracture, all just very satisfying things to be able to do. And I think also during my training, the departments were just very friendly and made me fit in very well. So I think the people in the NT are really nice and welcoming, and I've just clicked.
So I think, yeah, your comment about the team being really friendly, so that comes as no surprise to me. I hear only positive things about the experience of people working in the specialty of ENT. And you've mentioned a couple of things. You've said that people were really friendly and you've been treated really well. And I'm not sure, Fergus, if you're aware of the cultural work that I'm starting to undertake with everyone around. I actually think what you've just described, people being friendly, coming to work and knowing that you'll be treated with respect and that you're valued as part of a team, I think that's a huge thing that will help us to move our recruitment and retention challenges. And I know that lots of people are really up for that. So has that been your experience predominantly coming through your training and across different specialties? I would suggest that the feedback I get is that the experience of everyone, not just doctors in training, is variable. And I would imagine you're not immune to that as a medic. But is there anything that you think has absolutely been really important and made a positive impact to help you set out that you want to come back to Grampian, even if you have to go away? And are there any things that you think we could focus on to do a bit better? And I am asking you to particularly focus on our doctors in training.
Yeah, good question. I think there's a lot of levels to that question, and depending on where someone is in their career, there'll be different things influencing them to settle down with the job. I think as a trainee, it's quite turbulent because you never know where, it's difficult to plan your life because you have to rotate. But we've committed to buying a house in Aberdeen. My wife's likely to have good jobs in Aberdeen going for her as well. But personally, I think just having spent most of my time training here, I know the team well and I know the setup well here. So I think that would be easier to settle into a permanent job, knowing how things work and knowing your colleagues a bit better. But I guess you never know if the grass is greener somewhere else. So you do want to have to experience that, and you want to be able to bring things back from other places that you can benefit from locally too. Yeah, I'm just trying to think what.
I think you've touched on one of the things that I'm quite interested in, and I think it's about how challenging it is, and I'm not sure if everybody appreciates that actually how challenging it is for our doctors in training to be able to establish home life and to then have to continue to reapply for placements. And I think the word turbulent is exactly that. So not only on top of your academic work that you need to continue, the constant learning you're doing in your areas of placement and your areas of practical work, but actually being able to say we've bought a house is a huge commitment. And I don't know if you and your wife have children or not, but actually more and more of our doctors in training are starting families, and to move about the country with that is an incredibly challenging thing. And I'm not sure everybody appreciates that that's some of the stuff you guys have to put up with.
Yeah, exactly. You've hit the nail on the head there. So you've really got to think about every life plan you make, really, and ideally you shouldn't have to. But if we're thinking of planning kids, then we do have to think that I am going to have to go somewhere else for around a year, and is that going to be commutable? Potentially not. If it's Dundee or Edinburgh, how do we do we put our house on the rental market? Do we buy another house? Because ideally we don't move because we're quite happy here and we've got a nice house here. But yeah, I've already done 18 months worth of commuting to Inverness, which is a horrible, horrible commute because of the A96, and stayed in the hostel accommodation there while coming back at the weekend. So that was a bit draining, but it was worth it. And I did enjoy my time in Inverness, but you don't want to have to do that for a long time, and certainly you feel like you've done your fair share of driving by then, so only to have to do more is a bit daunting.
Yeah, absolutely. And I think definitely conversations that I've had with Nick Fluck, our medical director. I'm not sure if you've met Nick or not, and also with colleagues in NHS Education Scotland, so NES, just around, are we really doing the best in the way that we all the things we ask of you as doctors in training. So I'm hoping that there are conversations and opportunities to try and just have a strategic look at what what that looks like, but very much at the beginnings of that. And I'm sure you and your colleagues are really keen to reduce some of the turbulence. Although I hear you very clearly saying having experience in different areas is a positive thing as well.
Yeah, absolutely.
Yeah. So Fergus, COVID, and we were all going along, and actually before COVID was something that we knew and had to work with in Aberdeen. What was your experience of getting access to the breadth of training that you need? Because I know we were even challenged in creating the right amount of in theatre activity before COVID. So what was your experience before COVID, and how has COVID changed that?
Well, I've no complaints at all from my experience before COVID, and I think COVID has shown just how well we had it, really. It's made you appreciate how good things were before and how well the hospital ran, but COVID certainly has been a spanner in the works and has, no way about it, negatively impacted training, and I think still is. Although I think now the challenges we're facing are potentially less due to COVID and more to do with staffing, and it's difficult to know if this, things like nursing staffing in theatres, if that's been a result of COVID or a result of other things and just their work pressures and job satisfaction for them. But I think that's ultimately having a knock-on effect on surgical training now as well.
So I think you mentioned, Fergus, that prior to COVID, you were in theatre twice a week. Did I hear that properly?
Yeah, that was the aim, and that's kind of the model that surgical training's based on, certainly to reach your 2,000 operations within 6 years of higher surgical training, and to gain competencies to a certain standard. Certain operations you've got to be able to do in ENT to a level called level 4, which means that your supervising consultant doesn't necessarily have to be supervising you to be able to do those at all. They can be in a different room and you should be able to technically do that operation. So I'm at the stage just now where I've got 3 years left of training, and there's certain operations that usually I'd been competent in by now, but I've never done.
Yeah, and I know, so the clinical prioritisation that Grampian put in place, can't remember, but it was certainly pre-COVID, and then the rest of Scotland have adopted to try and just manage the clinical risk. I know absolutely it's had a huge impact on your specialty as well as others. But Fergus, you will be able to describe to people who are not clinicians the impact on people, the impact on patients and their families if they can't get access to surgery. Are you able to give a couple of examples of that?
Yeah, because we hear it every day.
Yeah.
We're seeing these patients in clinic who are suffering, and it's really difficult to have to tell them when they're likely to be able to get their operation, and there's hundreds of patients already on the waiting list for these operations. So you're talking years for the patients that are newly added to these waiting lists to have the problem that you're trying to fix.
Mm-hmm.
And some of them are desperate, and unfortunately it's the ones that are phoning the secretaries every day complaining that get escalated, and then they eventually get done if they get more prioritized on a waiting list. But I'm sure there's a lot of patients suffering in silence at home waiting to be done, and more people are going to be paying privately to out their own pockets to have the operations done if they're not willing to wait the length of the waiting list. Yeah, for us it's just not being able to get the experience of doing that operation for the trainees.
So I know you are absolutely focused on your medical education, but it must be really hard when you're faced with real life situations, with the distress that's causing people. How do you handle that? How do you speak to people who are distressed, and when you don't have an answer for them just now? That must be tough.
Yeah, I'm just honest with them, and I try and say, I wish I had more of an idea about when we could, when we're likely to be able to do this for you. But all I can say is that we've got you on a waiting list, and that if things do start to get worse, you try and make contact with the department, and we try and make a case for doing this sooner for you. Because it's so difficult to prioritize one patient over another. Because how do you how do you rank someone's suffering? It's very hard.
Yeah, well, and I think that's where clinical prioritisation seems really neat through the lens of clinical prioritisation, but we know that there are far wider harms that not having access to treatment is causing. So Fergus, I don't have the answer either, and what I do know is that every day I discuss how we manage to protect capacity for surgery, and that's not a unique conversation. It's happening across Scotland that I'm absolutely aware of, and I'm sure across the UK, but we have to come up with a different solution that's going to have more timely access. We're launching our new strategy, Fergus, in June with the board, and we did huge engagement with the public, and the thing that came out most strongly was, when I need treatment, I need it, and I need it when I need it. I don't need to sit on a waiting list for years. So my personal commitment to you and your colleagues is I am trying with the executives and much broader than that to understand how do we do this differently. And of course, any ideas from you and your consultant colleagues and trainees colleagues absolutely need to be part of that solution.
Yeah, that's good to hear, and I totally appreciate it's a bigger problem, potentially even a governmental problem, because
Absolutely.
you know, from our point of view, it seems to be, you know, we almost feel guilty because you know we're available. It's not a great use of us as a resource, the ENT team as a resource. We're used to be able to doing more operating, and even on the days we are operating, it seems less efficient now, and you know, a lot of it seems to be doing with staffing levels from theatre nurse point of view, you know, lists going slow because the patients can't get through to recovery, shortage of theatre nurses to be able to run more lists. So I think making it more appealing to be a theatre nurse is a good start.
Yeah, no, definitely, and the teams are on that. Fergus, I've heard lots of stories about the things that people were asked to do during COVID. Are there any things that you did that you thought, oh my goodness, I never in my wildest thoughts thought I would be doing this? Or did you stay in ENT? How did that work?
Yeah, I was probably quite lucky because I've heard some. I've got friends that are medical trainees in places like England who are just had and are still having a terrible time, just really overworked, really, you know, working hard on wards full of very unwell medical patients. But so I feel a bit of a fraud in that I've not had such a hard time, and I've had a lot of time to focus on other things. You know, the times that I've not been operating, there's been plenty of time to, you know, develop in other areas professionally, doing quality improvement projects, research, publications, teaching, and I've even had time to do like a qualification in leadership and management as well. So just trying to develop my portfolio in other ways and come up with ideas of how to be efficient. And yeah.
Brilliant. And I have colleagues in England, although actually in Scotland as well, that are still describing having a really tough time. And I know that we are too, and the loyalty and resilience of you and the wider teams is great.
Yeah. I think the
So
thing I forgot to say there was it makes it sound like I've been doing nothing, but the reason we have still been working in ENT, but the reason we've not been redeployed or so to say is that there are only 6 of us on the middle grade rota, and you rely on in fact there was 5 for most of it because there was a shortage, so we were doing extra shifts covering that 6th person who's now started, thankfully. So there was a lot of work to be done on ENT, but it was just the time I was operating spent doing that. And um, what was I going to say there? Uh, yeah, I think the reason we couldn't be redeployed was because, you know, we're required to run the ENT service. So if you pull trainees off the ENT on-call rota, then you've no longer got an ENT service because there's so few of us. So I think that's the reason.
yeah, and for clarity, not for a second did I think you were sitting doing nothing.
Yeah.
I absolutely knew that you and our medical training colleagues were really flexing and doing everything that they could, and that continues to be the case. Fergus, as you've outlined, you've got COVID just now, and actually, so that'll mean your colleagues are having to pick up the fact that you can't be there. So
Yeah.
it's definitely not it's definitely continuing to have a significant impact, and clearly waiting lists, etc., and the level of pressure. And I'm sure you have patients boarding in your specialty, so all of that remains really, really difficult. So listen, that's been really nice to get to speak to you. I'm glad, although you have COVID, you seem reasonably well.
Yes.
And it's been great to get a bit of insight for me, and I have a reasonably good understanding of your training programs, but hopefully for others who don't realise lots of the competing things that you have to think about, will give people a bit of food for thought. And I am delighted that you've had such a positive training experience in Grampian, and look forward to hearing that you come back when you've been to your other centres to apply for consultants posts. Fergus, is there anything else you would like to say on behalf of yourself or your colleagues, as broader trainees, or as your ENT team? Is there anything while you've got me on the call you'd like to say?
No, I think we've covered quite a lot there, and just thank you really for listening and for reaching out and for involving so many people, and yeah, spreading the word.
Great. Well, thanks very much, and I hope you feel better soon.
Great. Have a nice day.
Thank you.
Bye bye.